The three sneaky Part A traps that you could fall into. Yep, that's what I'm going to talk about today. And if you stay to the end, I'm going to tell you how to avoid those traps. So I told you in my previous video that Medicare Part A pays for inpatient hospitalization, but we didn't dive into the details in regard to how Part A pays for hospitalizations or inpatient services, basically. So let's dive a little bit deeper into the benefits regarding Part A and these three sneaky traps that you could easily fall into. And then I'm going to tell you about how to avoid those traps. So the first thing that you need to know is that Part A, again, does not cover 100% of inpatient services. So with Part A, you have a deductible that has to be satisfied, and that deductible usually carries you through day 1 of service up through day 60 if we're just talking about just original Medicare. In 2024, the Part A deductible is going to be $1,632. So you paid that deductible, and then that deductible covers you from day 1 through 60. But when you get to day 61 through 90, there is another copay per day. That copay per day is $400. That's a lot of money, right? All right. And then so when we get past day 90, from 91 on, if you end up in the hospital that long, you have a $800 copay per day for the next 60 days, which are your lifetime reserve days. Now, here is the first sneaky with that Part A. Unlike traditional insurance, where your deductible goes from year to year, your Part A deductible go by benefit periods. Your Part A deductible works more like this. When you are out of the hospital for 60 straight days and you go back on day 61, you start a new benefit period. Yes, I said it, a new benefit period. So if you add it up, you could easily have to satisfy that $1,632 about 5 to 6 times in a year. That's the sneaky. So unlike traditional insurance where your deductible carries you through the year and you hope you satisfy it, you could end up having to satisfy your Medicare deductible up to 5 to 6 times in a year. The second sneaky thing with Part A is this. It covers you for inpatient services, but the fine print is that if you receive doctor services while you're in the hospital, that's not covered unless you have Part B. I know you're thinking like, wait a minute, but that's part of being inpatient. You can't really be inpatient if you're not seen by a doctor. You're absolutely right. That's why I call it the second sneaky, because while you're in the hospital, you are going to see a doctor. So even though Part A pays for the inpatient services, it doesn't cover your doctor services. For example, when the doctor visits you after a surgery, or when the doctor comes to see how your vitals are and talk with you about your medical condition. If you don't have Part B, guess what? You're paying that expense. All right, and the third sneaky thing about Part A is after day 90, you have 60 reserved lifetime days. What does that mean? That means that in your lifetime, you can only use up 60 reserved days after 90 days. So God forbid that you are in the hospital, need skilled nursing care, or whatever. If you go beyond day 90 in a benefit period and you start exhausting your reserve days, you don't get any more reserve days. And that puts you on the hook of potentially paying a very huge hospital expense unless you have something to avoid it. So, what can you do to avoid the expense of Part A? The first thing you could do is get a Medicare supplement or a Medigap plan. Since Medicare supplements or Medigap plans pay whatever Medicare does not pay, you just need to make certain that whatever plan you choose is going to give you coverage for hospitalization, and most of the plans out on the market will pay what Medicare does not pay for hospital services. The second thing you could do is you can get enrolled into a Medicare Advantage plan, but you must have Part A and Part B in order to get into a Medicare Advantage plan. Now, remember I told you that Medicare Advantage combines Part A and Part B through a private insurance company, such as whoever, and they generally offer more comprehensive benefits than what you would receive through original Medicare. So when you have a Medicare Advantage plan, at some point, if you're really, really sick, the plan picks up at 100% for the remainder of the calendar year. And the last thing that you could do to make certain that you are not falling deeply into the 3 Part A sneaky traps is get Part B when you sign up for Part A. So if you do have a hospitalization, at least you could know that the professional services that you're receiving while you're inpatient will be picked up by Part B. And those are the ways to avoid those sneaky financial pit holes that you could be in when it comes to Part A. I hope you liked the video. If you want to learn what Medicare does not cover, click on this next video. Don't forget to like and subscribe to this channel and also turn on notifications because I'm going to be posting a video every week.